The member from Ottawa West, Napanee.
Thank you, Speaker. I'd like to thank the member for Hamilton West, Ancaster Dundas, for bringing forward this very important motion. It addresses a very crucial issue in our province, one that is seriously impacting the residents of my riding of Ottawa West Nepean, and it's an issue that I've done some advocacy work on myself. When you find yourself in an emergency situation, minutes matter. I've had to call an ambulance twice in my life, once for my father-in-law and once for my son. I remember that heart-stopping feeling of wondering what was going to happen and if my loved one was going to be okay. Thankfully, the ambulances came quickly, and I didn't also have to worry about whether the ambulance would come in time. 2.5 years ago, I came to the legislature, my very first time here, on behalf of CUPE paramedics to present data showing that paramedic services were under serious pressure. Call volume was increasing, especially among the most serious and most urgent calls. The time it was taking to offload patients at hospitals was increasing, tying up ambulances for lengthy periods of time instead of getting them back onto the road. The CUPE paramedics and I warned the government then that the numbers showed the pressure on the system was unsustainable, that we were already seeing more and more periods of time when no ambulances were available or when ambulances had to be pulled from other regions to cover shortages. We told the government that we were reaching a point where Ontarians could not be sure that if they called 911, an ambulance would come. Sadly, the government did not listen to us, Speaker, and now we find ourselves in the terrifying situation where ambulances not coming or not coming for hours is a commonplace occurrence. When I was knocking on doors in Ottawa West Nepean over the past year, I heard horror stories from residents about waiting for ambulances. One woman waited 2 hours for an ambulance, terrified the entire time she was going to die. Her daughter finally came and collected her and drove her to the hospital. Just this past weekend, we learned in Ottawa this year there have already been over 1,000 level 0 events where no ambulance was available. That's already a 33% increase over the total number of level 0 events in 2021, and we still have 2 whole months to go, Speaker. This is a dangerous game of roulette we are playing with people's lives. Sooner or later, someone is going to pay for this shortage with their life. We are already putting people into incredibly stressful and harmful situations, both the patients and their loved ones, and the paramedics and dispatchers who have to live with the moral injury of seeing crises go unaddressed. We're seeing the results of this in Ottawa. A survey of paramedics in CUPE Local 503 earlier this year found that stress levels are very high, while morale levels are very low. Workers are being forced to work overtime every day, skip meal breaks, and to live daily with the knowledge that serious calls are going unanswered. No wonder Ottawa is experiencing a retention problem with dispatch staff. It's long past time to take action, Speaker. The government needs to ensure that our paramedic services have the capacity that they need, that they are adequately resourced and have enough ambulances and paramedics to respond to the level of population need. We also need to make sure that our hospitals are able to offload patients quickly, which means addressing the crisis in health care, repealing Bill 124, and recruiting, retaining, and returning nurses to the healthcare sector. I hope the government will support this important motion, and more importantly, that they will do what it calls for. Thank you.
Thank you. The member from Tecumseh.